Stevie, who's our model today. I'm Dr. Iris Ramirez at Pet Wellness Center in Fort Myers, Florida. We're going to demonstrate a physical exam on a kitty cat. Kitty cats love heat, and they don't like cold metal tables. So suggest to your vet that they get a heating pad, and then they can put a towel on top of the heating pad, and then Stevie has something to sink her claws into. Okay, and Stevie's ear is nipped because she was part of a feral cat colony, but now she is part of Chrissy, the camera woman's colony at home in the house. And Chrissy is working with us now and studying to be a veterinary nurse. So the vet's going to look over the pet and see that Stevie looks very nice. And she has a beautiful glossy coat. She's well hydrated. When you pick up her fur and her skin, it pops right back. And her nose is moist. Her eyes look moist. It's got nice whiskers. Her mouth feels a little bit moist. Sometimes when they're afraid, it could get a little tacky. And she's got, well, we'll get to the muscle mass. So the way I do my exam is I generally go from start to back because it's just easier for the old doctor to remember everything. So we look in her ears for tumors, infection, ear mites, inflammation. And she's got nice looking ears. And we look at her muscles on her face, and we see that they're symmetrical. We see that the pupils of her eyes are symmetrical. One pupil is not bigger than the other, which can indicate a problem with the nervous system or the brain. Could indicate a concussion, lots of things. We also notice there's no discharges from the ears, the eyes, or the nose. She's getting annoyed. We may not get through a whole exam talking this much. And then we look in her, hi sweetie, you're so cute. And then we open her mouth to check for tumors or broken teeth, whatever in there. And if you want to zoom in to look at her mouth. So as we look at Stevie's mouth, we need a third person to hold the light. You can see she has a pretty nice looking mouth, really clean teeth, Chrissy, and really little in the way of inflammation on those gums. So, whoa, and how old is she?
She is 2, turning 3.
Okay, well that's nice because a lot of times today, even on the young cats, I see problems. I don't even see tartar, so that is excellent. Really good. And we check the lymph nodes under the chin. We pick up the head to feel the thyroid gland. We should not be able to feel the thyroid gland on a normal cat. Good girl, Stevie. Yeah, you're so good. And now we're going to listen to her little ticker. You can check the little feet to make sure there's nothing going on there, no ingrown toenails. That's how you get a cat's nails extracted. Good girl, Stevie. And then we get her heart rate, which is racing at this point. Whoa, her heart rate is well over 230, which is totally abnormal. Can be a sign of hyperthyroidism, overactive thyroid. In this case, a sign of a terrified kitty. Hi, honey. She's actually doing very well considering she's so afraid. I wouldn't even know she was afraid except for that racing heart, giving me that clue. And we go further feeling along her body. You're so cute. And we're feeling all the lymph nodes in the kitty, right? We're looking for any signs of masses. Maybe she's not as terrified as I think. Maybe you should get her resting heart rate at home. And, okay, and then we'll check her little kidneys. Yeah, you're so cute. She's got a little small kidney on the left for her size. The right kidney, normal shape and size, and the liver and the spleen. The guts are not inflamed, the intestines, and you check the joints on the kitties for swelling, heat, inflammation, lack of movement, or any crunching in the joints, which we're not having in her case. She's a sweetie. So maybe she's not that scared. So I think you should seriously get a resting heart rate when she's home. And then we've got the baby scale that we're going to put her on. But anyway, that is an example of a physical exam on a kitty, much of which you can do yourself. Check their hydration, check their little mouth, pull back the little lips so you can look back there. Look at the little feet. Look at the ears. Feel their body for any changes in the symmetry of the muscles, any weight loss, any tumors. You can use a flea comb that can help you to search. Yeah, you're a good kitty. Search for fleas on the cat. When I look for fleas, I often search going the reverse direction on their head, because then I can catch the damn things. Excuse my French, I don't want to film this over again for that.